Hi everyone, and thanks for joining us for Facebook Live today. I am here with Jessica Scram, and we have a special guest, Sawyer, today. And we are going to be talking about pediatric physical therapy. So Jess, why don't you give us a little bit of a rundown of what's going to be happening?
Right, so today I'm going to just show you a few different exercises that we do with our older pediatric population and how we like to make sure that they're having fun while also being productive and obviously doing some work as well.
Yeah, absolutely. Well, no better time than the present. Let's get started. If you have trouble hearing us for any reason, we are in a big room. We're using a tiny little mic. Just comment below so we know, and we will get started.
All right,
awesome.
so I've got Miss Sawyer set up with a fun little obstacle. So this is an obstacle course, which obstacle courses are a lot of fun for the kiddos. So the first thing that we're going to work on is some squat jumps. So we're going to squat down and up, okay? So try to keep our knees apart. We're going to do 10 of those. Ready? 1, good. 2, keep going. So this is a really great activity. What I'm watching for is making sure that Sawyer doesn't drop her knees together. So we're getting a good squat to help strengthen the muscles. Good. Let's do 2 more.
Now, Jessie, we're talking a little bit earlier about the importance of her knees not touching when she's jumping. Why is that?
So this is to help protect.
I got 10 of them.
Okay. Okay, let's do our out and ins. Okay.
Like this.
Yes, ma'am. So that helps protect the knee joint, and actually, whenever we bring our knees together, we're just resting on our ligaments. So it's really important that we have good form. It helps align the hip, the knees, and the ankles better.
I did a lot more than 10.
Oh, you did? All right, and then we're going to do our scissor kicks. So up and switch. Good job. 4, 5, 6, 7, 8, 9, 10. Awesome job.
All right. Now
Perfect.
This is the fun part, right?
This is the fun. So this is a wobble bridge. Oh, Sawyer, let's come back over here. So what we're going to do, this is actually wobbling, and so this helps work on her stability and balance. So go ahead and step up here. And what I'm going to have you do is you're going to reach with your opposite hand for the cone, and then reach way up high. Perfect. Reach across. So this is helping to promote rotation along the long axes, which is good. It helps with postural and trunk control. Very good.
She got 2.
She is a master at the wobble bridge. All right. And remember, when we're squatting, we're keeping our knees slightly apart. Reach across. Very good. So squatting and returning to stand takes a lot of energy and effort. And again, I'm really watching her posture to make sure that she's doing it correctly. Perfect. Good. Knees apart. Reach across. Good.
So, Jess, why is it important for to incorporate some play into
Their attention.
Right.
And we want to make therapy fun for them because we want them to enjoy coming. Do you enjoy coming? Yes. Good.
Good job.
And with the kiddos too, it's not always, okay, let's just do 15 of these, and then we're going to do 15 of these exercises and 15 of these. If you make it into play, then they really don't realize that they're really working.
Right.
All right, good job. Jump down.
All right, everyone, if you're watching, can you give me a thumbs up if our picture is clear? I'm a little concerned that I'm on the Wi-Fi, so it may not be as clear. So if you can see us and you see us clearly, let us know. And if you're having any trouble with the viewing, let us know. But we're going to move over here to a new activity.
All right. So these are little hurdles.
I'll walk all the way to there.
Are you going to walk across the bridge to the hurdles?
Thank you, Anne, for the thumbs up. Bree, thanks for the thumbs up. Really appreciate that.
All right. So the next activity, go ahead and come over here, Sawyer. So this is going to help promote single leg balance, which we during our normal daily lives, at any given point, we do have to be able to stand on one leg.
Okay.
So this is kind of a fun way to do that. So we're going to stand on one leg, Sawyer, and we're going to do 2 taps, and then over, 2 taps. Okay. All right, here we go. Tap, tap, over. Tap, tap, over. Good. Tap, tap, over. And to make this more challenging, we have hurdles that are a little higher. So I can have her progress to those. Because she is doing really awesome with these. Good job. Okay,
Awesome
now we're going to come
job.
over and do our hops over the hurdles. Can you show us how you hop over the hurdles?
Yeah.
All right.
Sawyer, what's your favorite thing about coming to physical therapy?
Walking on the
Walking on the bridge.
All right, here we go. You're gonna squat down and jump over. Good
Wow.
job. Very awesome. Good job. Okay, now we're gonna come over to our, and then we have our other helper.
Special guest. Oops.
Our special guest. All right, you ready, Miss Sawyer? Or do you want me to do this by myself? Huh? Do you want me to do this? Or do you want to do this? Want to do this? All right. So go ahead and put your feet up here.
So what is she balancing on, Jess?
So these have many different names. We like to call them our hedgehogs, but this actually is just an unstable surface, so it makes her work her muscles a little harder and also improves her balance through the legs, and then also working on core stability.
Okay, very
And then I'm
good.
going to ask her to bend her knees slightly, and this is called a Zoom ball, which is really great because it's going to be promoting her to open up her arms to strengthen our upper body, our upper back muscles to improve on posture. All right, ready? So we just learned how to do this, so we're in the very beginning stages. And then open, close, open, close. Look at you go. Bend your knees a little bit. Good job, Sawyer.
So what sort of things are you looking